Hi, my name is Vikas Srivastava, and she is my mother, Premlata. She has been suffering from knee problem over last 10 years or so. It has started with like a little pain, but gradually it became quite bad, and then there was a point when it was not even possible to walk a single step without significant discomfort and pain. And that's when we started looking for options that what can we do. So I live in Hyderabad, but she's from UP. So I contacted my friends and sought their opinions and suggestions. And one thing that came up quite quickly, that Dr. Ram Mohan Reddy probably is one of the best surgeon in this space. And all of them, they had a recommendation that we should get the knee replacement done as soon as possible. And it's these days it's a very common surgery, so no need to be scared. But still, as she is 70 years old, we had enough reasons to be worried about. And we contacted Dr. Ram Mohan Reddy. He checked her thoroughly, and he showed us like how bad are the knees. It's practically impossible for anyone to walk in that condition. And he recommended us to go for the bilateral knee replacement, and it will fix the problem. Though doctor said that it will fix the problem, but I mean, I was little doubtful looking at the shape of the legs were literally curved like this, and so I was not really sure that how that's going to get corrected and how much it will help. But as we didn't have any options, we thought that okay, we should go for the surgery and get it done. And we got the right knee surgery done first. And I should tell you that after the surgery, when she was walking after a week in home, I looked at the leg and I was kind of confused that is it the same leg? How a leg can get straightened like this after the surgery? And but that's the kind of correction and improvement that's possible with the surgery. Overall, after 4 weeks of recovery, she was in much better shape, and which encouraged us, and we felt much more confident to go for the next leg surgery also. And we got the second leg also done. And let me tell you, I mean, it's been roughly 4 months now since this whole process started. Right leg first, then the second leg. And it's nothing less than a miracle to see her walking close to 2.5 kilometers every day. I mean, I'm extremely satisfied and with the outcome of this whole surgery. And I would strongly recommend anyone who is suffering with these problems to get this corrected. Medical science has evolved a lot. These are like best doctors, best technology available. There is no need for anyone to be suffering with these kind of pains. My only probably the remorse or one thing that I repent is that we should have gone for the surgery many years before, instead of waiting for her to turn 70. But still, it's still quite good outcome, and better late than never. Hospital, in my words, I mean, it's a very nice hospital. I mean, you and people here, all the staff, it's very supportive, and they are very there is very friendly environment all around. I mean, you would see people always like looking to help you. You don't even like need to reach out to someone asking for help. Before you even ask for the help, they know that there is some help required. So I liked a lot. And infrastructure and the room quality, it's excellent. I mean, the kind of rooms which are there, well ventilated with sunlight, big rooms, it definitely helps a lot for any patient and attendant who needs to stay in hospital. It's awesome, very nice. So thank you so much for providing this kind of care with such professionalism. It's really nice.
Good morning. I am Dr. Ram Mohan Reddy. I work as an orthopedic surgeon at Yashoda Hospital's High Tech Division. I am mainly a lower limb arthroplasty and trauma surgeon. I deal with joint replacements of the hip and knee. I also deal with failed joint replacements, including revision surgeries as well as complex deformity corrections. My other area of work is in knee sports surgeries using what we call keyhole or arthroscopic procedures. Today, I would like to talk to you about Mrs. Premalata Srivastava. Mrs. Premalata Srivastava is in her 60s. She has grade 4 arthritis of both the knees. Grade 4 arthritis means the cartilage in the knee joint is completely damaged. Both the bones come together, and because of the friction, it causes intense pain, swelling, deformity, as a result of which she was not able to walk. She had been to many centers, after which she came to me for consultation. I did a thorough assessment, explained to her about grade 4 arthritis. I also explained to her that medicines like painkillers, vitamin supplements, exercises and kneecaps are not going to help her much in walking. She also inquired about injections like visco supplements, which is artificial cartilage injection, other injections like stem cells and platelet injections. I have explained to her that these injections have no evidence and that the American Academy of Orthopedic Surgeons have mentioned in their document that they can be given, but the patient should not expect complete cure or benefit. Mrs. Premalata Srivastava was convinced and she agreed to go ahead with the knee replacements. I did one knee at a time with a gap of 3 to 4 months. As of today, she is pain-free. She is able to walk 3 to 4 kilometers. She does not need any major painkillers. She can walk up and down the stairs. She is leading a very healthy life, able to socialize with her friends and go for long walks. That's a very satisfactory outcome for me as a surgeon, as well as for her. Thank you.